Hi, Lisa Marie Kosis, founder of Global One Health and Global One Fitness. I decided to do a video series that addresses anatomy and ranges of motion of a few of the joint structures of the body. Having been a trainer for many years and trained numerous clients, I've come to realize that the better understanding clients have of their anatomical structure and their joint structures and how these joints move and what limitations the joints have, they often move more mindfully, which is going to keep them safer. So while it's important to teach this while I'm in session, I hope that clients do their homework and exercise on their own. And for people that they're watching that I've not trained, the goal here is that to give you a little bit more of anatomical education and background. The better that you know what limitations joints have and what muscles should be working at any given movement, you're more apt to be conscious of such. And at the end of the day, whether your goal is to get stronger or more flexible, you want to be moving mindfully. Right? That is going to ensure that you're moving safer. And the primary goal in any strength training regimen is that you're moving mindfully and safely, and minimizing potential risk for injury is always what's of the utmost importance. So that is why I'm doing these videos. I'm going to start with the shoulder, as it is the most mobile joint in the body, and oftentimes as a result of that, it can be very commonly injured. So I decided to give a little bit of understanding or background about the shoulder, about the ranges of motion of these joints, and then go into a little bit of muscular explanation of what muscles surround the joint so that you have a better understanding of the whole overall structure. So being a ball and socket joint, we only have two such joints in the body, the shoulder and the hip. So while the structure is the same, there is one slight difference, and the primary difference is how the ball sits in the socket. So when we talk about ball and socket, a very quick, easy visual I give to my clients is if I make a fist with one hand and I put that fist inside the palm and fingers of the other hand, that kind of demonstrates or illustrates what a ball and socket joint looks like. So just like you would put a plug into an outlet and it fits in there perfectly, the ball is designed to fit into the socket. So while the head of the femur, which is your thigh bone, while the femur kind of fits up deeply into the socket, it's a little bit different design, whereas the shoulder joint, the ball of the shoulder joint sits a little bit more to the outside of the socket. Therefore, it does give the shoulder a little bit greater range of motion and mobility than the hip joint, even though they are both the same type of joint. Now, ball and socket refers to the planes of movement that the joint can move in. So it is a triplanar joint, which means that the shoulder joint can move in three directions: forwards and backwards, sideways, and across the body. So firstly, the sagittal plane. So when I refer to sagittal plane movement, that is a forward-backward direction of the arm in the shoulder joint. So when we're talking about planes of motion, we're referring to the joint specifically, not the arm. The joint structure is the shoulder joint, right? So if my arm can move in a forward-backward direction, that means that the shoulder joint is moving in the sagittal plane. I am moving my arms forward and backwards. So in the forward direction, so arm moving from a neutral anatomical position and it moves forward to in front of me, that is what we refer to as shoulder flexion. So the arm is moving in flexion at the shoulder joint. The opposite of that would be the arm moving backwards. So as my arm moves back behind my body, that refers to shoulder extension. So again, it's referencing the movement of the joint itself. So shoulder extension is the antithesis of flexion, but they both are an example of what it means to move in the sagittal plane. Now, secondly, the shoulder moves in the frontal plane. So frontal plane refers to sideways direction. So one general important footnote I want to address in this video is when we talk about anatomy, anatomy is referenced based upon our midline, and that has how all anatomical references are made in anatomy books and in medicine and in doctors when they refer to it. So when I'm referring to any basic range of motion at any given joint, it is always referencing in terms of our center point or center line, our midline. So that's important when we're talking about moving in the frontal plane. So as my arms move out away from my body, away from midline, out to the side, that is referred to as shoulder abduction. Abduction refers to abduction more specifically. Sometime in translation, when trainers are talking, or if you're talking quickly, sometimes the B and the D get confused. So if I'm saying shoulder abduction versus shoulder adduction, trainers will often reference, or doctors have done this as well, as they're referencing, if they say abduction, I've heard physical therapists use that reference as well, they'll spell out the AB to not be confused with adduction. And again, that's just in speech. Sometimes it can get lost in translation, and you want to make sure that that's very clear. So abduction, the prefix ab meaning away. I move my arm away from my midline. That is shoulder abduction. On the contrary, if I'm moving my arm across my midline, that will refer to as shoulder adduction or shoulder adduction, and that is moving towards and beyond my midline across my body. And finally, the shoulder moves in the transverse plane, which is, while it's a combination of the other two planes, there's an extra added component of that cross line in the body. So if I combined flexion and extension with adduction and abduction, I can put that together to create a circular pattern. So I'm moving my arm across my body, behind me, whether I'm moving in a forward direction or in a backward direction. This circumduction, as it's often referenced, is an example or is representing the transverse plane movement of the body. So it's forwards, backwards, sideways, and a cross-directional movement of the body. And both the shoulder and the hip move in that way because they are ball and socket joints. So that triplanar reference is because it's moving in those three directional planes. Now, so that is addressing the basic movement directions of the arm at the shoulder joint. Now let's talk a little bit more specifically about the muscles on the muscle groups that all affect and cross the shoulder joint. I'm going to start with the larger muscles first. And understanding in basic anatomy, muscles can be put in two categories, right? We have muscles that are large muscles. These large muscles are often referred to as global muscles, and those are the power movers. So for example, if I'm squatting and deadlifting, my legs, my thigh muscles, my quads, my hamstrings, and my glutes are the prime movers in squats and deadlifts. They are doing the horsepower part of the work, right? They're doing the large loading, taking on that large load. However, when squatting and deadlifting, the smaller stabilizers, those are the small intrinsic muscles as opposed to the globals, which are extrinsic muscles. These smaller intrinsic local muscles, their job predominantly is to stabilize. So in any given movement, you want to make sure that the large global movers are doing their job to do the actual movement component, but you also want to make sure that the smaller stabilizing muscles, the intrinsic muscles, are also doing their job to support the joint structure in the capacity that they are designed to do as well. So I'm going to start with the anterior side of the body first, that is the front side of the body. So when we're referring to the shoulder joint, the front shoulder muscles, or muscles that affect the shoulder joint, we're going to talk about the pec muscles. So the pec muscles predominantly rest on the sternum, but why it's important to talk about these is because the pec muscles attach onto the humerus, the upper arm bone, they directly affect shoulder joint movement. So we're starting with the front. So if we think about bench pressing, chest presses, push-ups, even planks in an isometric way, we are referring to the loading or the activation of the pec muscles. So you have two pec muscles in the shoulder, across the shoulder joint, pec major and pec minor. As the name would reference, the pec major muscles is a larger muscle group, hence the name major. The pec major muscles run horizontally across the sternum. So when I am pushing weight away from my body, when they contract, the pec muscles' job is to bring the arms in towards midline. So from a slight forward view, right, if my arms are out here in my bench or chest press, as I go into the press, I am moving the humeral bones towards the midline of my body. So that is an example of adduction, right? My arms are out to the side. I am pulling them towards my midline. The pec muscles, one of their primary functions is to adduct the humerus, enabling the arms to move up into the press. So the pec majors being the larger muscle group that does that motion. Let's quickly just reference the pec minors. They are just a smaller muscle group, and instead of running horizontally like the major muscles do, the pec minor fibers run on a slight diagonal, going kind of from this angle up towards the top of the shoulder, kind of like in a little V. So if I want to stretch my pec major muscles, I would put my arms directly to my side, as that is in line with the fibers of the pec major. If I want to stretch my pec minor muscles, I would have to have my arm up, because that is the direction that those fibers run. So both pec muscles are predominant movers of the shoulder joint in an anterior or forward direction. In contrast, if I face backwards, the prime movers of the shoulder joint from the back side of the trunk are the lats and the serratus anterior. Now the lats, I think I refer to those with my clients as the big guns. These are the power horses of your back. So for example, if you want to strengthen your lat muscles, which will give you a significant amount of strength in the shoulder girdle complex overall, the two basic examples of that, of course, are pull downs and pull-ups, right? But the lat muscles lie here, and just as I referenced why they're important is they attach, the lat fibers attach on the upper arm bone, on the humerus, just as the pec muscles do. Therefore, they are a very important muscle group when you're looking to strengthen the shoulder girdle structure. So pull downs, pull-ups, right? I'm using my lat muscles. And when they contract, I'm also doing adduction of the shoulder joint as my arms are starting in this position, and I am pulling my arms into my body. I am contracting the lats, which initiates, again, shoulder adduction. The serratus muscles are important in push as well. We're going to get more specifically talking about those. But in referencing that, I want to talk now not just about how the arm moves at the shoulder joint, but let's talk more specifically about the scapula. The scapula are the shoulder blades. Because the shoulder is a ball and socket joint, the scapula will also move in 3 planes. Let's talk about that now, because that is a very important part of shoulder anatomy, is understanding how the scapula move. So the shoulder blades, one of their directions is elevation and depression. So when I activate my upper trap muscles, I am pulling my shoulder joints, and the shoulder blade is part of the whole shoulder girdle structure. So when I elevate my shoulders towards my ears, my shoulder blades move into scapular elevation. The antithesis of that is depression of the shoulder blades, which is a pulling down of the shoulder joints away from the ears and plugging them into the back. That is what I refer to in my video about how to pack your shoulders. It is very important that you own that position, that movement direction when you are squatting, deadlifting, benching, and overhead pressing, kettlebell swings, kettlebell snatches. All of these movements and exercises require packing of the shoulders in an isometric way. So very important to understand that packing of the shoulders is a depression of the shoulder blades down towards the mid-rib cage and low back. Secondly, the scapular protract and retract. So if I reach my arms straight in front of me, if I continue reaching the arms in a forward direction, you're going to see how my shoulder blades move outward in a lateral way. So when I protract my shoulder joints, right, or reach forward, I am protracting the scapula, and they are moving away from my spine. That is a direct exercise that targets serratus anterior. The prime function of the serratus anterior is that it protracts the scapula. Now, anatomically, the serratus anterior is underneath the lat muscle, so it's a little bit deeper, meaning further from the skin. So we're talking about anatomy. Deep means closer to the bone structure, further from the skin. Superficial refers to the opposite, which is closer to the skin, further from the bone structure. So serratus is a pushing muscle in that context, but it pulls the shoulder blades apart. The opposite of protraction of the scapula is retraction, and that is the coming together of the scapula towards the spine. So that muscle group is the rhomboids, and the rhomboids lie, we have a left and right side, just like the serratus and lats. The rhomboids, when contracted, retract the shoulder blades. So that would be an example of rowing. And finally, the shoulder blades also move in rotation, which will be the transverse plane movement of the scapula. And if I use my hands as a reference, right, if my hands are my shoulder blades, the shoulder blades move up and down, right? Elevation, depression, open and close, protraction, retraction. Finally, the scapula move in rotation. So when I raise my arms up towards overhead, my shoulder blades are upwardly rotating. So we're looking at the bottom point is referencing the bottom of the scapula. So if the bottoms of the scapula turn upwards, that is upward rotation of the scapula, which is an example. This is what this looks like. So if I move my arms in an overhead position, my scapula upwardly rotate, and the antithesis of that, of course, would be downward rotation. The bottom of my scapula moving down together, back down in towards the spine. So now, in understanding one important thing about upward and downward rotation, it's not starting from down here. Usually, upward downward rotation really starts to kick in once my arms are about 90 degrees to my body. So you want to be about horizontal positioning. When you're referring to upward downward rotation, that is generally referencing beyond 90 degrees. And that's important when you want to think about or talk about what muscles you're trying to strengthen in reference to the shoulder girdle. So now we've talked about the pec muscles, major and minor, in the anterior part of the body, the posterior side of the shoulder joint. Specifically, I talked about the lats, are the adductors, the serratus are the protractors, the pushing forward. And I also talked about the trapezius, which is a very unusual shaped muscle, as it's shaped like a diamond. So the upward traps elevate the shoulders, and the mid-low trapezius are the downward pulling muscles of the scapula. So that is kind of the basic muscle overview of the posterior side of the shoulder. Now we'll get a bit more specifically into the smaller muscles. So again, understanding the larger muscles are the global muscles, the power movers, right? Your bench press, your push-up are the power movers in the anterior direction. The lats are the power movers in the posterior side of the shoulder joint structure. But let's talk more specifically about those smaller muscles. Now, when we're referring to shoulder, people often think of the delts, right? Raising the arms out into the side. So we have 3 deltoid muscles that make up that muscle group. And they refer to the different parts of the shoulder capsule, right? So the front of my shoulder is the anterior deltoid, and that is responsible for that sagittal plane movement of my arm in shoulder flexion. So if I want to strengthen those anterior deltoid muscles, I would do an anterior delt raise. In the opposite side, if I'm moving my arm behind me, I am strengthening the rear deltoid muscles of that shoulder cap, and that is going to take my arm into shoulder extension. And finally, the lateral deltoid is responsible for the lateral delt raise. But when we're talking about lateral delt raise, so if I have dumbbells and I'm raising my arm sideways, from here to maybe here, the first, let's just say 10 to 15 degrees of movement from neutral, straight down, to the outward direction, I'm not really going to get a lot of lateral delt activation. I just want to address this point because it is important when we're talking about the shoulder joint. Once I get to here and I continue raising upward and outward, this is about where my lateral deltoid kicks in to complete or continue the range of motion of abduction. Abduction, when I'm raising my arm out to the side, that doesn't kick in till about here. So something else does, which brings me to the last area that I'm going to address in the video. In terms of the shoulder joint, I really need to address the rotator cuffs. They're the much smaller muscles of the joint and therefore often neglected and often injured. Rotator cuff tears are extremely common, unfortunately, but a very big reason for shoulder joint injury. And the reason is that when you're doing the big exercises, the power exercises, the push-ups, the presses, the pull-downs, the big, large global muscles are doing predominant amount of work. So because of the big muscles are doing the work, they're going to be loaded and engaged most likely in any one of those given movements, but it's very easy for the smaller shoulder muscles, the stabilizing muscles, to not get engaged and not even be involved in the movement. Therefore, if they're not turned on, even though they're smaller, they're not as powerful as the prime movers, they're equally as important so that your entire joint structure is engaged properly and fully to minimize injury. And a lot of people don't understand the importance of thinking about the small muscles because they can get lost in translation, and I see that a lot. So when I'm training my clients, I very much incorporate, as I mentioned at the beginning of the video, teaching my clients the importance of knowing about these smaller muscles, that they need to work too. Because if they're put under load, but they're not engaged properly, you are putting yourself at a greater potential risk for injury, unbeknownst to yourself if you're not aware or thinking about these muscles. So the rotator cuff muscles are very, very, very important muscles in the shoulder joint. They have two primary jobs. Their primary job is, when under load, they are acting as stabilizers in some contexts, and in other contexts or other exercises, they are also involved in movement. So for example, I talk a lot about corkscrewing when we're talking about weight bearing. So I've talked about rocking and introduction to planks, right? So all of these movements, push-ups, for example, but if I'm just holding a plank, or I'm doing rocking, or I'm doing, right, a bird dog, if I'm weight bearing on my arms, we always want the arms to be doing a few different intentions. And I'll use that word because that's the best word I can use to describe it. So when I'm weight bearing on my arms, this is important to address in this video, right? There are three primary things that my arms and shoulders are doing to work and need to work to get proper support of the muscle activation to provide support to the joint structure. So of course, I don't want to collapse into the movement. I want to push my body away from the ground. So I want to push my arms into the ground to prevent me from collapsing in the shoulder joint structure. So there's a driving down of the arms into the ground, but there's also a corkscrewing. And corkscrewing refers to, and it's used in many different modalities. I've heard it referenced very often in yoga classes, right? Or anytime you, in animal flow, which I'm certified in, any of these weight-bearing exercises, it's important that you understand that the arms need to corkscrew in the shoulder joint. What that means, and in more anatomical definition, that the humeral bones are externally rotating in the shoulder joint. That is what we refer to as the corkscrewing. It is the external rotation of the arm in the socket, which is the activation of two of the four rotator cuff muscles, whose job is to externally rotate. Now, if I'm just going to hold a plank position with no movement, right, I am isometrically engaging my rotator cuffs to stabilize my arm and my joint, but I'm also isometrically engaging my external rotator cuffs to keep that external rotation actively working in that loaded plank. So, why the rotator cuffs are so important? Now, if I was to hold a heavy suitcase or a piece of heavy luggage or a heavy kettlebell, if I'm holding the bell and I let the weight take over, right, it's going to kind of pull my arm slightly out of the socket. Under heavy load over extended periods of time, if you're not properly doing farmer carries, if you're letting the weight pull your arm too far down out of the socket, you are basically pulling and tugging and over elongating the rotator cuff muscles, which can cause micro tears in these muscles because they are small. They can't be put under max load if they're not properly engaged. So going back to that fist, right, if I were to pull my fist out of my grip of my fingers in the other hand, that kind of pulling out energy, imagine constant pull on those little rotator cuff muscles can cause tears or major pulls. Their job is to suction or stabilize the arm in the socket. So if I kind of use my fingers and I don't allow the fist to be pulled outward, that is basically how a great visualization of what the rotator cuff's job as stabilizers is to prevent the humeral head from pulling too far out of the socket. So technically, the four rotator cuffs are acting as stabilizers in certain movements. Now, if you want to strengthen the rotator cuffs, you have to know which movements are necessary to do to strengthen that. And I'll talk a little bit more about that because I am going to do a video where I break down just some basic exercises to strengthen the shoulder girdle structure. But the antithesis of using the rotator cuff muscles as stabilizers is that they can also act as movers. So I mentioned we have four rotator cuff muscles in our shoulder. Two of the four are external rotators. One of the four is an internal rotator. And then the final rotator cuff, its job is abduction of the arm and the shoulder joint, but only from neutral to those first 10 to 15 degrees. So I wanted to kind of finish off on that explanation. So if you're looking to strengthen your lateral delts, they're not going to really turn on until you get to about here, and then they kick in into that final range, or the rest of that range, into horizontal abduction. But in those first 10, 15 degrees of moving the arm, the humerus, away from the body, that will be how you strengthen the final rotator cuff muscle, which does horizontal abduction, but only in those first 10 plus degrees of movement. So that breaks down all of the basic joint ranges of motion of the shoulder joint, how the arm and scapula move in context with the shoulder joint, and I addressed a lot of the basic muscles and muscle groups that attach and cross and affect the movement of the shoulder joint. So I wanted to break all that down. Such an important joint, but I am going to get into a few other joint structures as well. But please, I hope you find this helpful, and please keep in mind any takeaways that you can. So when you're loading the shoulder joint, understanding this basic information about the natural ranges of motion and what muscles affect and cross that joint structure will hopefully keep you safe when you are doing these more advanced and heavily loaded exercises.